What if your senior pet was begging you for help and you did not even realize it? What behind every slow step, every long nap, every quiet sigh, they were desperately trying to tell you that something was wrong? Stay with us, because today we're going to reveal the silent signs your senior dog or cat might be sending, and how you can respond before it's too late. Senior pets are masters of hiding discomfort. It is a survival instinct inherited from our ancestors, who needed to appear strong to avoid becoming targets. But in the safety of our homes, this instinct can become a dangerous mask. Behind their gentle eyes and slow movements, your senior pet may be struggling with pain, illness, or emotional distress without making a sound. One of the most overlooked silent signs is subtle changes in behavior. You might notice your senior dog sleeping more than usual, or your senior cat hiding in quiet corners more often. These shifts are easy to dismiss as normal aging, but they often signal underlying problems like arthritis, heart disease, or cognitive decline. Pay attention to deviations from their usual patterns. Another critical silent sign is altered eating habits. If your senior pet suddenly becomes picky, eats more slowly, chews on one side of their mouth, or begins to leave food uneaten, it could indicate dental pain, gastrointestinal discomfort, or kidney disease. Loss of appetite is never just a normal part of aging. It is a whisper from their body asking for help. Changes in drinking behavior are another subtle cry for attention. Increased thirst can be a red flag for diabetes, kidney disease, or endocrine disorders, while decreased drinking can signal pain, fear, or systemic illness. Monitoring your senior pet's water intake can offer early clues that something serious is brewing. Mobility changes are perhaps the most visible yet most misinterpreted silent signs. If your senior dog hesitates before jumping onto the couch, or your senior cat struggles to leap onto a favorite perch, do not chalk it up to laziness or stubbornness. It is often pain speaking through their reluctant movements. Arthritis, spinal issues, and neurological conditions can all manifest through subtle mobility changes. Another heartbreaking silent sign is a change in grooming habits. Cats are meticulous groomers, and when they stop, it usually means they are in pain, experiencing cognitive decline, or battling internal illness. Senior dogs may develop mats or an unkempt appearance if joint pain or fatigue makes grooming uncomfortable. Ignoring these signs means ignoring their silent pleas for relief. Breathing changes, even slight ones, are another critical warning. Increased panting, wheezing, coughing, or labored breathing can indicate heart disease, respiratory infections, or even cancer. If your senior pet's breathing seems off, even just occasionally, it warrants immediate veterinary attention. Subtle shifts in emotional behavior can also be silent cries for help. A normally affectionate dog becoming withdrawn, or a typically independent cat suddenly seeking constant contact can signal fear, confusion, pain, or cognitive decline. Senior pets may become more clingy or more isolated when they are scared, disoriented, or hurting. Changes in sleep patterns are often early signs of cognitive dysfunction. If your senior pet starts pacing at night, waking frequently, or becoming disoriented, they might be experiencing confusion or anxiety linked to brain aging. These are not just harmless quirks. They are symptoms of a condition that can be managed and improved with timely intervention. One of the most subtle but critical silent signs is changes in posture. A dog who hunches, a cat who sits unusually still, or a pet who frequently shifts positions while lying down may be trying to minimize pain. Watch for stiffness, reluctance to stretch, or favoring one side of the body. Inappropriate elimination is another misunderstood cry for help. Accidents in the house, difficulty getting to the litter box, or new urinary or fecal incontinence can be signs of urinary tract infections, kidney disease, arthritis, or neurological problems. Punishing these accidents only adds to their distress. Understanding and prompt veterinary care can make all the difference. Bad breath in senior pets is not just unpleasant. It is often a signal of serious dental disease or internal organ issues like kidney failure. Regular dental checks and early treatment can prevent a cascade of painful and life-threatening complications. Weight changes, whether gain or loss, are another silent alarm. Seeing your pets losing weight may be battling cancer, kidney disease, or malabsorption disorders. Gaining weight could indicate hypothyroidism, Cushing's disease, or decreased mobility leading to obesity. Even small fluctuations matter in older pets and should never be ignored. Another subtle but vital warning is a change in vocalization. If your senior dog starts whining more, or your senior cat meows louder, or at odd times, they are trying to communicate something. Pain, confusion, fear, or anxiety can all alter their vocal patterns. Listening closely to these changes can reveal urgent needs. Loss of interest in favorite activities is one of the saddest silent signs. When a senior dog no longer greets you excitedly or a senior cat stops playing with beloved toys, it is often because they are hurting or struggling emotionally. Rekindling their joy through gentle activities and medical support can restore their quality of life. Eye changes are another silent communication. Cloudiness, redness, discharge, or squinting can indicate cataracts, glaucoma, infections, or systemic diseases like hypertension. Because pets adapt so well, they often do not show obvious vision problems until the condition is severe. Finally, the most important silent sign is a shift in trust. Senior pets may become more hesitant, more watchful, or more dependent when they are unsure or frightened by their declining abilities. Recognizing this emotional vulnerability and responding with patience, protection, and proactive care is the greatest act of love you can give. Caring for a senior pet means becoming fluent in their silent language. It means noticing the whispers of discomfort, the soft calls for help that they are too proud to voice. It means seeing the struggle behind their brave faces and choosing to act before the suffering grows. If you recognize any of these silent signs in your senior pet, the time to act is now. Veterinary care, tailored nutrition, pain management, cognitive support, and above all, your attentive love can make an enormous difference. If this message opened your eyes and helped you feel more connected to your senior pet's silent needs, please subscribe to The Senior Pet Life. Your support helps us bring more life-saving insights to loving pet owners everywhere. Give this video a like if you believe every senior pet deserves to be heard, and leave a comment sharing how you have helped your aging companion find comfort and peace. Let us build a world where every senior pet's silent voice is honored and answered.